Hey everybody, my name is Dr. Blake Olson. I'm a orthopedic surgeon with Sports Medicine and Orthopedic Centers, and I'd like to continue this discussion regarding the use of PRP. The next topic I'd like to review has to do with the most common applications of PRP in our practice. What do we use PRP for most commonly? What orthopedic problems do we have requests from patients from? And what are the most common problems that we seem to find good outcomes with the use of PRP? So first off is arthritis. This probably gets the number one slot. I get more requests for use of PRP with arthritis than just about any other problem. So what is arthritis? I think probably the simplest definition is the absence of cartilage. So when a joint is missing cartilage, which is the substance that allows two bones to glide over each other, when that is missing, we call that arthritis. There's a variety of reasons for which arthritis can occur. Some may have to do with what we call inflammatory disease, such as rheumatoid arthritis or psoriatic arthritis. We also have, in certain instances, infection. The problems associated with infection can cause arthritis. We also have traumatic arthritis. It's often arthritis that's caused from a previous serious trauma that involved a broken bone that injured the cartilage. And then there's osteoarthritis. That's probably the most common one that we see of the knees, shoulders, and hips. In our practice, we get a lot of requests for PRP, and I think the success of PRP is dependent upon a number of factors. This is still evolving in our literature. We're learning more as far as how do we tweak PRP to make it the best so-called cocktail as possible. One of the things we do know is that you can't have enough platelets, but you certainly can have too little. So we make sure that our platelet count and our PRP injections is well over 5 billion. In fact, the system we use is upwards of around 10 billion. And then I do have a discussion with patients, and I think it's very important about the likelihood of having a reasonable outcome with PRP or deriving some sustainable relief. I think some of the things that we think about when we talk to patients about whether or not PRP is going to have some success is often a similar discussion we have for other forms of treatment short of surgery. It may include how severe arthritis is. It may include other things that they may have tried, or it may also include the health of the patient. I do think there's probably a link between how healthy an individual is and the likelihood of seeing some success with PRP. So continuing on that discussion regarding arthritis, there are certainly some mitigating factors I think have a significant impact on whether or not PRP is a reasonable option, meaning whether it's not going to have some success, provide significant pain relief, and whether or not it's going to last for a significant period of time. The two things that I consider often are the health of the patient, number one, and also the severity of the arthritic condition. So let's take the knee, for example. If someone comes in with an arthritic knee, let's say has some deformity, they're severely bow-legged, or they're knock-kneed, or let's say they have a history of severe trauma and the joint is bone on bone. There may be instances where the use of PRP is not appropriate, and the more appropriate treatment would be a referral to a joint replacement specialist. I think that's one of the important things for our practice as orthopedic surgeons is that we have a knowledge of when it's appropriate to consider physical therapy, when it's appropriate to have a discussion regarding PRP, and also when it's appropriate to pick up the phone and make a referral to a joint replacement specialist to have the joint replaced. So I think a close second behind arthritis-related conditions would be tendon problems. Examples include the rotator cuff in the shoulder, the gluteal tendon muscle at the level of the hip, the hamstring tendon on the back of the thigh, the patellar tendon at the level of the knee, and the Achilles tendon on the back of the ankle. Similar to arthritis-related conditions, I think there are times where PRP is appropriate and other times where it is less predictable. In our practice, when we evaluate a patient, we like to take the time to explain to them when traditional management is more appropriate, like physical therapy, and in which instances surgery is most appropriate. So, for example, if a patient comes in following a fall and has a massive rotator cuff tear, then the use of physical therapy or PRP is most likely not appropriate. In that instance, the patient is most likely best served by an operation to fix the rotator cuff. So I think it is important for your provider to have a good knowledge base of traditional forms of conservative management, a knowledge of the surgery for that particular problem, and then when it's appropriate to have a discussion regarding the use of PRP for a tendon condition. So next up is tennis elbow, otherwise known as lateral epicondylitis, and that is located right here. It's on the outside of the elbow. Why does lateral epicondylitis occur? Well, this is where the extensor tendons of the forearm originate. And we see this often as a problem associated with overuse in people that play racket sports. We can see it if you change the type of strings that you're using, if your racket mechanics are not appropriate or proper. We can see it with the weight of the frame or the size of the grip. There's a number of reasons that may influence the development of tennis elbow. Similarly, and for similar reasons, we also see golfer's elbow, which is located on the inside. This is one of the most common reasons that we use PRP, and there's a fair amount of literature on the use of PRP for the treatment of both tennis elbow and golfer's elbow. So next up is plantar fasciitis. Plantar fasciitis is associated with pain on the bottom of the heel. One of the most common symptoms that a patient presents with is heel pain in the morning. I'll say a few things about plantar fasciitis. The first thing is that the majority of cases are managed effectively with a routine program of stretching. So once again, I'll say that it's important for the provider to have a working knowledge of both the conservative as well as the surgical options that are available. And for this particular diagnosis, the majority of cases can be managed effectively with an ongoing program of stretching. So this is something we go over with our patients routinely when we're talking about plantar fasciitis. However, within that mix, there are certainly cases that do not respond to a program of stretching. I'll also say on the opposite spectrum that surgery, while it is indicated in some instances, in our experience, it can be associated with extremely variable outcomes. So it's not something we routinely recommend. One other thing I'll say is about cortisone injections. We don't typically recommend cortisone injections for the treatment of plantar fasciitis. We find that it does not provide sustainable relief, and it can also be associated with thinning out the very important fat pad on the bottom of the foot. So PRP we do find is a very reasonable option to discuss, especially in cases where traditional stretching is not effective. So I'd like to thank everyone for taking the time to continue this discussion regarding the use of PRP in our practice. As I said before, there are a number of orthopedic-related problems that PRP may be appropriate. That includes the treatment of arthritis, tendon-related problems, plantar fasciitis, tennis elbow, golfer's elbow. In summary, I think that regardless of the orthopedic problem at hand, it's important to have a comprehensive discussion with your provider of when it's appropriate. That includes the provider taking a history, performing a physical examination, obtaining the proper image studies, and based upon that information, being able to have a reasonable discussion when traditional conservative management is appropriate, when surgery is a consideration, or when it's appropriate to have a discussion regarding the use of PRP. If you have any further questions about this topic, please feel free to contact us on our website at smocsc.com. Thanks again. Have a great day.